Hello, everyone. Welcome to MamaTalks. Today, I'm so excited to be talking with Dr. Nahinu James. She is a chiropractic physician, and she focuses on treating pregnant folks as well as kids. And so we are chatting with Dr. Nahinu today about the common discomforts that many people have during pregnancy and how you can help to address those. Do you want to say a word about your background?
Yeah. Thank you for having me. I'm honored to be in this space. And I just always kind of knew I wanted to do pediatric focused work. I thought that used to be pediatric optometry. And so I was very much on that path until I took some time off after undergrad. I passed the oats. I thought I was going to enter optometry school, everything. And I was like, you know what? I'm just going to go back home to Oahu and kind of make sure this is what I want to do. And I started working at a wellness center and I fell in love with chiropractic care.
Mm.
I immediately changed course to apply to chiropractic school in Portland, so University of Western States, and focused continually on pediatric chiropractic care via the ICPA, so the International Chiropractic Pediatric Association. And that kind of just snowballed into treating kiddos, me realizing how much of a disservice there is to the pregnant patient and the birthing body. So it quickly became more of a very strong focus on creating a community and support system for the birthing person. Yeah.
Okay. Thank you so much.
Yeah.
Well, my first question is, as a chiropractor treating pregnant folks, what are some of the most common discomforts that you see people having during pregnancy?
Yeah. Understandably, low back pain and that SI joint, so right where your hip crests meet that bone in the center of the pelvic bowl called the sacrum. There's quite a bit of achiness and discomfort there. Both very understandable with the shifts and changes that occur in the body. And then round ligament pain is another really common one. We also see quite a bit of SPD, which is just symphysis pubis discomfort or dysfunction. And carpal tunnel syndrome is another pretty common.
Mm. Okay. Well, let's start with the low back pain issue too, because like even as a prenatal yoga teacher, I find that that is probably the number one thing that people are finding to be bothering them during pregnancy. What do you advise patients with low back pain to do?
Yeah. So it's because you're getting that, there's all this inherent natural adaptation to a growing baby, and your body's inherently doing it so that you have a smooth labor and delivery. But that shift in center of gravity is going to put extra pressure on the tissues, your joints, ligaments, and muscles of the low back. And so just finding ways to, we talk about neutral pelvis. That way you're not getting, since you're already getting kind of pulled forward from your growing belly, if you work on, I think of it as like a happy dog wagging its tail. If it was sticking its tail out, so like our tailbone, then we're tilting ourselves way too forward versus like a
Mhm.
sad dog that's tucking its tail in. And then we're all of a sudden creating this poor posture for ourselves. So if you do the extremes of happy dog way too tilted forward, almost like you're pouring a soup bowl out, or sad dog way too, if you go back and forth between those extremes, if you find everyone's neutral pelvis or middle ground is different, but you'll find like sitting right on those sit bones, that's your neutral, and it should feel very stable and not like you're dumping out a bowl or like you've got rolled forward shoulder.
Yeah. Okay. I feel I have to stand up for a second. Just I so connect with what you're saying. So like the pelvic bowl is like here, right? And one way people can tell is just to like look at their pant band. So like if you're tilting forward, like the happy dog, it's going to tilt forward, right? And if you're sad dogging, it's going to tail down. So you're talking about finding that place where it's horizontal, right?
Yep.
And as you get pregnant, naturally it's going to want to tip forward because the weight of the baby. That's such a great cue about just finding that neutral pelvis and how that can help your low back.
That's a big one. Honestly, just through your day, especially if you do have a desk-bound job, it's just being mindful and checking in like, hey, am I dumping out? And that's I should have stood up. But yeah, it's that I don't have as good of an angle as you, but that kind of dumping out and pulling forward, and just even in a seated position, like, hey, am I directly on my sit bones? Do I feel neutral and stable?
Mm-hmm.
Yeah.
Yeah. One thing I noticed too with a lot of women in pregnancy is I think because it's so tiring to be pregnant, a lot of women stand like this to one side, and then that side will get really tight. So I feel like having people coach to center their weight over both feet instead of over to one side has helped some of my prenatal patients with that low back issue too.
100%. Yeah, that stable, equal weight in both heels. And then I also, if I know a pregnant patient of mine has several kiddos and this isn't their first, I'll check in like, hey, did you do a lot of hip carrying on one side more than the other? That way I know. I love getting a painting of what the body's already been through, because then I know what we're coming in with and I can help take tension off of those areas that have had prolonged stress and just create ease through the system, so there's less of an imbalance. But even checking in on that, like oftentimes if we're right hand dominant, we'll understandably want to keep that hand free. So we'll do a lot of left hip carrying of our.
Oh, that makes so much
Yeah.
sense.
Yeah. And so I'll check in with that a lot just to see. I'm like, okay, wind these, we call them, so if you're really fascially dense on one side, and fascia is just that kind of sticky, sinewy tissue that covers all of our muscles and organs. It looks a lot like the sinew on an orange if you were to peel it open. But just on winding, I focus on soft tissue work and on winding compression tissues. That was blood vessels, tendons, and ligaments are super happy. But yeah.
Thank you. You also mentioned kind of like pubic symphysis pain, like around, this is one I see a lot too, like when people have pain here, especially in yoga, if they do like a split leg stance, like a warrior or a lunge, people will often have that. What do you recommend to women who are experiencing that kind of pain?
Yeah, I unfortunately, like, it's my least favorite answer, but it's so we can protect our body through that time period. But double leg movement, so not doing the, as much as you can, avoiding that split of like where you are taking, I need a better angle. But when you are taking that one, like if you were to do a, say you're getting out of a chair, sometimes we'll
Yeah.
swing and then the other. So if you can do leg movement together and keeping knees together, and oftentimes not doing that shearing motion where you're separating the joint even more and creating more stress on it. But
Okay.
yeah, and then
We're gonna cue somebody else to go into like a warrior, for example. Maybe they could do something like chair instead, where their legs are facing the same direction.
yeah, that'd be perfect. And honestly, anything you can do if you are going to be doing a day that's more physically demanding, a long walk, anything, because that joint, it's move pretty minusculely, just naturally, but because all of that extra laxity in pregnancy, you get even more instability through that region. So you
That
can
makes
also
sense.
wear, yeah, you can also wear a super comfy, they just call them SI stability belts,
Hmm.
but it doesn't only have to be for that joint in the back. They're really good to just bring stability for the whole pelvic bowl as a whole unit. So they can help take pressure off that pubic bone too. So if you know you're going to have a super active day doing prenatal yoga, a very long walk, bar, you can throw that on as well. And it's super helpful.
Okay. Okay. Is there any specific brand or type that you recommend?
I love either the Fit Splint for more if you're very athletic, or I'm obsessed with the Sorolla belt. They're both really comfy. It's just I've found over the years of practicing that some patients prefer. I've found that a lot of patients are like slowly moving more towards the Fit Splint, just because it's less compression, so you can move through a workout, but it still offers you that stability.
Okay. Okay, cool. I will definitely put that in the description so people can find it too. Yeah, I like how you like, so the pelvic bowl, it's like people think of it as a fixed structure, but there's actually a little bit of movement, right? Like, so
Oh yeah.
then having that bracing there can just keep things stable, because when there's a twist, there's that shear pressure, and that's oftentimes what causes that. If this were my pubic symphysis, to have that pain there, so that totally makes sense.
Well, and I often tell my pregnant patients the pubic bone is, I feel the worst for the pubic bone because it takes on so much stress, especially throughout pregnancy, because your abdominal muscles, so that typical like six pack that we think of, they attach to the pubic bone from above. And then your inner thigh muscles, they call it adductor group because they bring your thighs to midline, they attach to it from the bottom. And then the round ligament technically goes from the top of the uterus to just below the pubic bone, and it attaches to your labia majora, so the bigger of the two, like, section of the lips. But it just takes on so much stress from those muscle attachments and ligamentous attachments. So it's nice to, I do love when I hear that individuals are doing prenatal yoga or bar, because that really helps to create core stability and then tap into your glute strength so that you're using your body's primary stabilizers and hope stress off of other areas of the body and creating more stability and less stress on that pubic bone.
Well, that totally makes sense. Another question I had was, you did such a great post on round ligament pain. So how can people tell if, because I feel like the pelvis is kind of like this black box. You're like, I feel something in there, but like, how can people tell when they're experiencing pelvic pain if it is round ligament pain versus other types of pain? And what do you recommend doing for a round ligament pain?
Yeah, I'm going to try to push this back so I can do more of a standing. It is very distinct. It feels more, it's like a crampy sensation, or it can be because the round ligament's very special as compared to other ligaments. It's got these fibromuscular fibers in it, so it can contract like your muscles anywhere else in your body would, hamstrings, calves. So if we ask our body to do something pretty quick, like a transitional movement, like laying to sit or sit to sit, can contract pretty quickly because it's within the abdomen. So when we're using our core for those transitional movements, it can we can get that quick shooting sensation. But it's very much, I like to use the landmarks of, so if you at belly button and then you've got your hip pointer bones here, it's phenomenal landmarks, because if you go diagonal between the two and you do nice little belly rubs, which is almost a really cool way to prep the tissues and do abdominal massage, it's almost two birds, one stone, because you're giving yourself a nice abdominal massage to ease the tissues, but you're also working to find the structure. And since it does run from right about where your belly button is down to just below the pubic bone, you'll find it's very distinct. You'll be like, okay, softness, softness. Oh, there's a very rope-like structure. It's very band-like. And right now my left is actually, I can feel that it's a lot tighter than my right. But the side that you feel like, oh yeah, I can tell there's a lot of tension there, if you take that side, the leg off to the side and then back, so if you're doing almost like a side and back, that will stretch the tissue for you even more. And then as it's stretched, you can do right around that structure, that band-like ropey sensation. You can just do a nice soft spreading of the tissues. And that's another way to give yourself almost like a nice self-massage.
I love that. Okay, so the way you can tell it's round ligament pain is like if it's in kind of in this area, but it feels like a crampy pain, and it's more if you do a sudden movement, and the ligament feels like a rope, and you can feel for it yourself by going between the belly button and the ASIS hip point and just feeling for it. And then if you feel it, you can work on it and also take your leg back to stretch it. Did I get it all?
Oh yeah, and then it's just while you got that stretch where the legs off to the side and back, you can just do a nice spreading around that. So just left side and right side, just spreading the tissues around, because trapped around that round ligament, you can just show that area some love, and it'll kind of help ease the tension around the round ligament. But it understandably, the poor round ligament, as the uterus grows to accommodate for growing baby, because the round ligament attaches to the top of the uterus and then anchors it to the pelvic bowl, it's bound to get stretched and pulled and lengthened. So it does undergo quite a bit of stress. But there are ways we can be very mindful of how we're moving I like to call it the sexy slide. So instead of doing a very quick, like, get off the bed, crunch kind of situation, if you roll, similar to yoga, if you're on your yoga mat, you roll over onto your side and then push up using your core and your arms. That'll be less of a, hey, I'm asking my abdomen to do all the work, and be more loving to the round ligament and other structures. And then there's a mnemonic of nose over toes. So if you're getting up from a seat and you act like you're doing, you kind of take nose over toes and then do a really nice squat up, you'll protect those structures too. Yeah.
Yeah, that's really neat. I didn't even think about that. Like when you're sitting straight up suddenly, I always think about engaging the abs, but then how does that pressure transfer to other structures in your pelvis, like the round ligament? That's actually really good to know. How about carpal tunnel syndrome? You mentioned that that's something that you see a lot as well.
Yeah. It really depends on, there are some pregnant patients that have come in with it, and it varies in severity. So during pregnancy, the carpal tunnel is just a passageway in your wrist where nerves, blood vessels, and tendons run through to innervate the hand and fingers. And those nerves and tendons and blood vessels, they help with sensation and movement of the hand and fingers. But in pregnancy, you've just got more retention of fluid, mostly because of the increased blood volume for both you and baby. So there's just more likely a compression and irritation of those nerves, blood vessels, and tendons. So you get a lot of those sensations, tingling and numbness, because the nerves are irritated and compressed, or like throbbing because of the blood vessels being compressed, or even sometimes, if I see a pretty moderate to severe case, a lot of trouble gripping and holding onto objects because of the tendons being compressed, so that, you know, the end of your muscles help for movement of each, like the hand itself and each digit. But there is quite a bit of stress placed on that region. And then relaxin, which is just one of the main hormones that surges throughout pregnancy, it creates a lot of stretch on the tissues. So if you add in the increased fluid retention plus the stretch on the tissues, you just got this extra component of irritation for those structures.
Mm-hmm.
Yeah.
I saw some great tips that you did in your video. It sounds like doing like a combination of heat and cold, as well as doing like some stretching where you do extension of the wrist, and then something with the fingers too.
Yeah, so it can feel really nice to do. I first and foremost tell individuals to get in with a prenatal massage therapist, just overall to show your body TLC, because it's going through some of the biggest physiological changes that it'll ever go through. So prenatal massage therapists know how to decompress those regions, and they can focus, if you are dealing with quite a bit of compression through the wrist, through that carpal tunnel, they can do a lot of work through the forearm muscles and like into the hands, through the, yeah, the ice and heat's really nice because ice can help decrease the inflammation that's occurring, and the heat can just increase circulation through your system as a whole. So I like to do like an ice pack and then a hot water bottle, and you can do 1 minute for each at a time for a total of like 5 to 6 minutes, kind of flipping back and forth between the two. But everyone, I had a few patients where cold doesn't feel good. It actually exacerbates. Sometimes just heat. I actually have one patient right now where heat makes it feel way. So it's just individualized, like between patient to patient and individual to individual. But also some, if it's not like, oh, I don't really like the ice pack and the hot water bottle, running cold water, like doing a bath over your hands and wrists for 10 minutes. Paraffin baths have been proven to be really helpful too. Yeah, and resting splints. Honestly, I have a lot of patients through the years where a resting splint at night can really help the ache and throbbing away from that area. And then, yeah, there's a lot of really cool. So sometimes if it's a really severe case and at home tips and tricks aren't working, I will look up hand therapy with a physical therapist or occupational therapist. But there's like, yeah, you can do the thumb. That way you're just keeping everything moving. You're not allowing too much restriction through the region, but you can do the thumb to each fingertip at a time, 10 times on each side. And then I really like the making a fist again and again. That way you're getting blood pumping through the area and you're not allowing too much restriction and compression to happen through here. And then I like progressing, if that's helping, and you can do that 10 times on each side, I like progressing that move via like a soft, squishy, almost like those stress balls that we use. You know,
Mm-hmm.
and progress it via holding onto a ball and squeezing, opening, opening. And then oftentimes, literally, if you wake up like, oh, because it tends to be the worst in the morning, you can just hang your hand off the side of your bed, do wake to get things moving and less compressed, irritated. That's a good one. And then, yeah, if you have a surface to relax your forearm on, and if you were bending your wrist over the edge of the surface and then bringing up and doing a full flexion, full extension to your comfort level and repeating that 10 times, that's really helpful too, just to bring mobility and fluidity through that area. And that one can be progressed by holding on to like if it's feeling good and helping and you don't have any like flare ups and you feel like, yeah, I want to progress that one, you can just hold on to a super light free weight or like a can of something and then do up and down. Yeah.
That's great. So with all these great things that people can do for self-care, how do you figure out like when is it time to seek professional help, like from a chiropractor during your pregnancy?
Yeah, I honestly tell everyone, because it is like a marathon event of your body prepping for the birthing process, which will be like the biggest marathon that we've ever run. I tell everyone to whatever resonates most with you. It doesn't have to be chiropractic care, but getting in early so that you don't have to wait till you're miserable. You can very much find an individual to help you through the process to keep you comfy until baby decides to make their debut. So it's very much, I mean, I've seen individuals as soon as they've found out they have successfully conceived, as early as 9 weeks, I think is the earliest I've seen. And then up to, I'm coming to see you because baby's breech and I'm 37 weeks. It all depends, but honestly, the earlier the better. That way we can create that relationship with you and keep you comfy and stable until birth, labor and delivery. Yeah.
Thank you. So where can people find you if they wanted to work with you?
We just opened up a second location for our business.
Congratulations.
Yeah, it's exciting. I'm a co-owner at Zen Space Wellness. It's off of Alberta. So that's our primary location. And then our second location is the Wellness Doctors off of Northeast Broadway.
Oh, congratulations. That's awesome.
Yeah, it's exciting. We're like slowly rolling out, I guess, announcing everything.
Yeah, thank you so much for being here, Dr. Nahinu James.
Yeah, thank you for having me.